conference is just to let you know that the Aroha Music and Cultural Society is organizing a concert for the benefit of the Poor Patient Fund of the Robert Hospital. I felt that as musicians we also have a moral responsibility, and the little that we can do is to raise funds through our music. So we have collaborators in the hospital, the Roberts Hospital, and a few other artists like Adil Masad, the cellist, Benedict Hinyota, the flautist, Dapale Stacey Warjri and her dance academy, Linkit and his friends from July. So I'm very thankful that you've given me this opportunity to let the public know that we're doing something for the health sector, and we hope that it will not only end in this. So the concert is on the 19th of October in the Sosothaam Auditorium at 5 p.m. And all the proceeds will go towards the Poor Patient Fund of the Roberts Hospital.
So why only Robert Hospital? There are poor patients all over the state.
Yes. See, we can only do so much. We have to start somewhere. This is the hospital that I was born in, and my grandfather joined this hospital as one of the first Indian doctors. My mother grew up there. So what better way than to start in the place where you were born? And I hope that it will go on to other things. And we've done not only this concert, but we've also done podcasts with the doctors involved, the Robert Hospital. And then we've also done, we're going to do back-to-back panel discussions and health awareness programs starting on the 17th, which is the day after tomorrow, at the Pearly School. And then we have another health awareness program on the 18th at the Sosothaam Auditorium as well, and a free health checkup done by the hospital.
Do you think how many patients will benefit from this?
Well, we're hoping that many. I can't say. I can't predict how many will come. So, in as far as we can spread the news, I hope that many patients will come. It's from 10 to 5.
So the inmates who are patients, Roberts, they
Yes.
also benefit from.
Well, I think it's the people who can come for the checkups. The inmates are already in the hospital. So the ones who can come for free health checkup will avail of these facilities.
Yes, earlier you mentioned about your father, Robert's Hospital. This is a dream.
Yes, my father had always wanted me to do something for the hospital because that's where he was born, and I could not fulfill this dream when he was alive, because I thought he would live to a very ripe old age. But now that he's gone, I just want to honor that memory, and I wanted to do something in a very small capacity.
Ma'am, one question.
Yes.
Suppose you are into a fundraiser for the help for the poor, treatment for the poor people. No?
That's
If you happen to rate Meghalaya's health system in providing a treatment to the poor people, from 10 to 1 to 10, how will you rate? In which category?
You know, the hospital has categories for that because they have a way of screening patients, because you can't give help to everyone. So they have a screening system, and they have a committee to decide who will benefit most from this, and to screen out possible people who just take advantage of the situation. So they have all that in place, and in our meetings we made sure that all this was in, the checks and the balances were in
No,
place.
his question is, how do you rate Meghalaya's?
That's not for me to say. That's for the
Yes.
experts.
Yes, what happened, ma'am? Still, you
Yes.
have come out to we can say you have come out to the street. You see the situation that which is not in favor of poor people when it comes to the treatment.
Yes.
Definitely. So I just want to know that how do you look? Why miss the rating? How will you rate this system now for the treatment?
I can only tell you from stories that I have encountered. For example, when my father was in the ICU in Negroes, there was, we always chat with the fellow attendants. So one day, one man told me that he was leaving. So I said, how is it you're leaving? Your wife is not all right. He said, madam, I have no more money. And I got into a panic because I saw his wife was very ill. So I got in touch with the doctors, and then we all got together, and whatever we did, then we realized he was from Dr. Mukul Samma's constituency. And so we managed to get to the Chief Minister, and we raised a few funds, and then the hospital also kicked into action, and they said there was counseling for these people, and then the MHIS came in. So that was the little that we did. Now you tell me, how am I going to screen people? I can only do as much as I encounter, and I can't do that for everyone. But I thought if we start with an awareness, we start from somewhere, and somebody else, it takes a spark, then somebody else will do that. I am just a musician. There's very little that I can do, but I can start something. And to finish the story of this young man, his wife had a very bad heart condition. She was also pregnant. So in the end, we got them to stay back. She got the treatment, but she didn't survive. But the good thing that came out of this was her son was born, and they were able to save the son. So, that's all I can say, and that's why I wanted to do something, because I've been in and out of hospitals, caring for my aged parents, and I've come across so many who are they don't know what to do. So they need to be educated, and that's why I started these podcasts, so that people in the rural area at least can have some access to some knowledge, and they should know whom to contact. So we did a first podcast about 2 weeks ago, and already from there I have about 16,000 views, and people are saying thank you so much, because there are certain conditions they didn't realize their children were suffering from, like autism, and there's some cerebral palsy, but they know that there are certain places that they can go to for help. So this is not just for not just for the government to do. This is not just for one organization. But if you and me, ordinary people like us, if we do something, the easiest thing for me is to complain and to point fingers and say, oh, the government is not doing this, is not doing that. But have we taken the trouble to even chat with the government doctors? Have we taken the trouble to talk to the problems they face with funding, with lack of funds, so everybody faces a problem. So what we need to do is just start a dialogue, and it only takes a spark to get a fire going, as one song goes. So that's the least that we can do, and I hope that what I'm doing will also, as they say in Khasi, Kanyapur, or that somebody else will take the lead, and we can work together.
Just mean this type of thing you are going to organize in future also,
yes,
no?
Yes.
It will be in a mission mode, we say.
In fact, I talked with our Chief Minister, Conrad Sangma, and he is very happy, and he said, Kong, I am very concerned about the maternal health, because our maternal mortality is the highest in the country. So I feel very, very strongly about that as well. So we will continue to do these things. It's not that we're just doing a one-off thing. And this is also to honor my father's memory.